Hello, everyone, and welcome to the first lesson of the ergonomic woes of the dental professional. My name is Lani McBeth, and I am a registered dental hygienist and clinical educator. Today, I'm going to speak on ergonomics and how it impacts your career in the dental profession. It's a hot word these days because how you sit, stand, and move at work directly impacts your career's longevity. Remember the toy Slinky? When I was a child, I received many Slinkies. I would watch it crawl down the stairs in motion from one step to another, but I would also pull, twist, tangle, and distort the poor Slinky until it no longer functioned. Well, humans are a lot like a Slinky, and we need to protect our bodies from preventable ergonomic disorders before we end up like mangled and malfunctioning Slinkies. In this course, I am going to provide you with some tips and tactics on how to deliver excellent patient care without sacrificing your spine or any other part of your body. We are only as good to our patients as we are healthy. So, respecting ergonomic principles is important to preventing career-ending injuries. I'll touch on some ergonomic considerations to help extend your career and keep you injury-free. After watching this course, you should be able to identify the risks and common injuries in the dental environment, employ techniques to prevent injury inside and outside the operatory, recognize ergonomic technology to enhance safety and prolong careers, and recall new-to-market devices that assist in enhancing clinical comfort and safety. Also, this is an interactive course. There will be demonstrations for some stretches for you to try at home or at work. Plus, there are accompanying resources for this course that you can download or view at your convenience. Let's begin by looking at the definition of ergonomics and some statistics related to the dental profession. Ergonomics is an applied science concerned with designing and arranging a workspace to increase efficiency and productivity, and reduce discomfort. It's known as human engineering or human factors. So, what are the ergonomic principles that apply to the dental professional? Well, it involves designing, adjusting, and changing the operatory or the front desk so injury can be prevented. Think about this. How many of us just adapt to our working area without considering our long-term health? Well, there's a lot of us, according to research. A 2012 study of dental professionals found that dental hygienists have a greater prevalence of musculoskeletal symptoms and are at greater risk of developing problems in their upper extremities, like carpal tunnel syndrome and back pain. In the study, 83% reported neck pain and 76% reported shoulder pain. Dr. Bethany Vallecki, an international recognized expert in dental ergonomics, says more than 70% of dental students and 83% of dental professionals are affected in one way or another when it comes to musculoskeletal dysfunction. Vallecki also says the most common cause of early retirement for a dental professional is due to musculoskeletal disorders, which affects 29% of all early retirees. These numbers are telling. They're telling us we need to do more in the way of ergonomics in the dental practice. Think of ergonomics as the fit between people, technological tools, and the environment, meaning equipment should fit the user instead of forcing the user to fit the equipment. The first factor to consider when looking at ergonomics is our body. We need to take into account our age, weight, fitness level, and genetics. Plus, women must also consider pregnancy and chest size. Next, consider the instruments and the equipment you use to do your job. For instance, periodontal instrumentation involves forceful movements combined with awkward postures and prolonged vibration of handpieces. Even extracting teeth involves excessive force, repetitive motion, and fixed working positions or static posture. Take a moment to think about what your equipment looks like where you work. How is it positioned in the operatory or the front desk? Do you use tools that keep your hand and wrist in neutral position? Now think about the environment. With advances in technology, we are sitting more than ever in every aspect of our lives, and seated workers are at greater risk for spine, circulatory, muscle, and joint injuries. Consider the type of stool or patient chair. What is the height of the countertop? Are you focused on making tasks comfortable and efficient for yourself or for your patient? What about the pace of work? how much twisting, reaching, leaning, gripping, repetitive motion exists in your job. Working as a dental professional can sometimes be like working on an assembly line. Scale, polish, repeat, drill, restore, repeat, answer phone, computer, repeat. There are lots of repetitive behaviors and movements. Efficiency does make tasks easier to do, but it shouldn't come at a cost. Think back to the childhood story of Goldilocks and the Three Bears. Goldilocks was searching for the porridge temperature that was just right for her. Let me ask you, have you found what chair is just right for you in the operatory or at the front desk? Ergonomics is about finding a balance in sitting, standing, and active movement. You need to recognize the source of your poor posture or neck or lower back pain. Is it the position of your chair, poorly designed equipment, or simply bad habits? If you are having trouble visualizing your work environment, take a picture of yourself while seated. Are your arms in a neutral position? What procedures are you not in neutral position? What can change in the operatory or at the front desk to improve your posture? My guess is that most of you will likely need some ergonomic adjustment to avoid injury. But there's another reason to have an ergonomic workspace: economics. Be it an accident or poor posture, a career-ending injury has devastating financial impact on both you and your employer. It can be a long recovery process for you, which may include missing workdays and missed paychecks. In addition, you may accumulate medical bills and other expenses. Maybe you don't have enough sick leave hours to use to heal yourself. It can also be a long recovery process for a practice when it loses an employee for a long or short period of time. It's estimated that a 3-month short-term loss of a hygienist can reduce a practice's production by about $78,000. Production at $187 per hour, 35 hours a week, for 12 weeks adds up fast. To have a visiting hygienist come into a practice can expect to pay at least 1/3 more for those services. Let's say the average hygiene wage is $35 an hour times an additional 33%. That's an additional $5,000 in salary. Not to mention the loss of restorative recommendations out of the hygiene chair. The bottom line here is injury costs a lot. But the good news is there are things we can do to prevent injury and reduce potential financial loss. I'll show you how in the next lesson. Stay tuned.